Forehead is about pretty much about 10 to 12 shots.
So it's like 2 to 5,000?
No. Forehead is about between $400 to $500.
Oh, 4 to 500?
Yes. Mm-hmm.
Oh, so it's the procedure shot, not each shot.
Absolutely. Well, it depends. Some people do charge by the shots. Some generally it's by the area.
Now, do you notice the difference in Kim's lip?
Yeah, there was no weight on this. I already see with the collagen in the lip. You can see. You didn't do the whole lip, though, right?
Not right here, because I have enough there that I just do the sides.
So, will it stay this big, or is this going to come down now?
It's going to come down. Pretty much about 20% of the volume is going to disappear within about 2 hours, just because of the nature of the product.
And how long will this last? The Botox, you have to do it at least 2 to 6 months. What about with collagen?
Well, collagen, it also depends how much you use your mouth, but it could last between 3 months to about 4 or 5 months.
So if she's kissing a lot, that kind of thing, it works.
It goes away faster.
It goes away faster.
Yeah.
Oh, I would think that would puff it up a little more. No?
I have no idea. Now, what's it feel like? I mean,
it just feels puffy, swollen, like there's water or something in there.
Is there any pain? Do you feel any pain?
No.
Any pain?
No. I mean, you feel
right
it,
now?
but no.
So when people come in, and is this the most requested thing they want, the Botox or the collagen, or is there something else that they want more than anything else?
As far as non-surgical, yes. Botox is really the prime, the prime non-surgical procedure that they ask for. And after that, the eyes. Eyes has been a big thing. Pretty much, I would say 80% of my practice is eye surgery.
When we were talking backstage,
I
want to tell you, after this commercial break, there was only one Botox procedure I would consider. Wouldn't do it in the face.
And somebody had it?
People are having it, and I bet you would like it, and I would like it, because it's something we both deal with and don't like. And I bet we both would be interested in it.
Okay,
right
I'm
after
intrigued.
this. Oh. Is your new puppy stressing you out? Are you having a hard time with potty training your new pooch or just teaching him to behave? If you've recently added a cuddly canine to your family and you need some Uncle Matty advice, give us a call right now at 206-404-LIVE or email us at nwa@comotv4.com. Botox party today, and Dwayne in our audience has a question regarding this. Hi.
Hi. I'm just curious of whether it's applied to any place on the body other than the facial area.
Is there a place that you are thinking you might want some of this? Where do you have wrinkles that we don't know about?
Where do you want collagen?
You know what? This brings me to what I was talking about before the commercial break. You and I, we both deal with this all the time. You know what it is, too, don't you?
We sweat.
We both perspire, don't we? Yep.
Well,
we both do. It's a
That's why
problem.
I keep arms down like this. Yep.
I always wear jackets. I don't wear light outfits.
Should come by our desk someday. Woo! Yeah, all right.
We both have it. I had it since I was in 5th grade. It's been an issue. And Botox can be used to help you stop perspiring?
Yes. People have been injecting the Botox right at the level of the gland that they create the sweat. Even though it's not, it's outside of my area of expertise, I can tell you that the success with it is pretty good.
So basically, you're shooting it into the armpits, and you're killing off the nerve endings, because Botox basically kills things.
Yes.
Okay, and then that'll only last 2 to 3 months.
Yes, pretty much.
Okay. And
does it fire off somewhere else there? Like it's not here? Is it coming out of your arms?
Is it going to suddenly... That's what I was thinking. It's just going to suddenly pop out somewhere else.
My finger.
No, it pretty much is going to, exactly as you said, is going to stop the nerve to fire and to stimulate the gland. So the gland will not start sweating.
Did you know you can get surgery for that too? They cut the nerve endings and you can actually
get absolutely.
surgery?
You can do a sympathectomy, which is the nerve that goes there.
Want to go in together with me? Want to do that together? We could do a show on that. Both of us getting surgery for sweating.
Both get our stink. Forget it. Natalie, first of all, you're beautiful.
Thank you.
And you're 60 years old. How did you do it?
No, how old are you? Seriously.
I'm 25.
And you were in our Botox party, and you were getting Botox?
Yes.
Why?
You're 25.
Preventative care, I guess, for later on.
Well, wait, if it's for later on when? If it only lasts 2 to 3 months, and you don't have it yet, and you're 25, why would you do this?
Well, the reason is what we try to do at that age is we don't want the line to show up, because when they show up after that, they are definitely there. Let's say, in Kate's example, if we were able to put my hand on his when he was 20, you would never have these lines.
Is it because I'm laughing and everything so much and the
Yes.
lines get moved and so then this
That's
just
okay.
create the line? So if you stop that, you won't create the lines.
Correct,
So
absolutely.
just stop
This is what it is.
laughing. There you go.
I can't. Jacqueline's got a question for Victoria. Hi, Jacqueline. You there, Jacqueline?
Jacqueline and Victoria?
I am
go
here.
ahead.
Yeah,
Hi.
thanks. I just wanted to know if any cosmetic surgeon can give the injection of Botox for migraine headaches. I've heard a little bit about it lately and the success that has been had with it.
So-
I'm just wondering if I could possibly find out if any cosmetic surgeon...
Can anybody do that for migraines? And can she maybe learn to do that herself for her own migraines? Be able to get the Botox as a prescription and then take it herself?
Yes and no. I mean, it's difficult to inject yourself. You know, what we find out for the migraine, the best place to inject, in fact, is between the eyes. We call the glabella right here. This is where we have the best result for it. I mean, it's very difficult. You just imagine coming with a needle right here. I would not recommend to do it yourself.
I could just see slipping and missing. One part all wrong.
But pretty much everybody who is, either a general plastic or a head and neck, facial plastic surgeon, some dermatologists, or some ophthalmologists do that. So yes, people who are trained in facial cosmetic surgery should be able to inject Botox with no problem.
So,
And
Jackie, how are
shouldn't
you?
insurance cover that? I'm sorry.
No, unfortunately not right now.
That just doesn't seem right if it does make a difference. Okay.
Jackie, how are you feeling?
Great.
So what did you have done?
I had the area between the eyes here done. I had a really, really deep furrow, and so I had that done.
Let me see you furrow now. Let me see you do it now.
See that? And it was so deep that it actually was indented even when I wasn't making the face.
Oh, really? So
what's-
now you can't see that.
Right, exactly. And this is my second procedure, so the more you do it, the less this is ever going to show again.
I mean, you don't see, as you sit there now, you don't see it.
Right,
Hold your hair up just a little bit so we can see that. Yeah.
And I actually also did collagen, but only on the right side of my face because I wanted you to see the difference. I have pretty deep frown smile lines, and we plumped up the right side, and I've hopefully get the left side done later.
Okay. So wait, if she has
Or you
deep
just walk around
lines,
like this all day.
I don't understand. So she has the deep lines, and you
Yes.
plump it up.
Yeah, I did collagen in the lines here, in my frown lines. And I wanted them to disappear, and so that's what.
Do you worry you could get addicted to this stuff? Just a little bit. You do worry about that, don't you?
Well, I don't really worry about an addiction, but it's
It's fun and you like it, don't you?
Yeah.
Jan has a question. Jan?
Were you ever unhappy with any of the results from any of the collagen or the Botox done?
No, I absolutely. That's why I'm back. That's why I wanted to come back for more because again, the line in between the eyebrow here was so deep. I mean, you know what? I always looked like I was mad or angry because it was so indented. And Dr. Gaboriau injected it for the first time in December.
Anybody who shouldn't think about this, we've got to go and take a break. But anybody who should absolutely not even consider this stuff.
That's correct. Yes. First of all, pregnant women or breastfeeding, we don't know. We have no study done right now, so that's a no. And also, see if you do use your forehead to raise your eyebrow, don't do your forehead.
I might be in trouble. Thank you so much. We'll be right back.
For more information about plastic surgery or Botox parties, contact the Sammamish Center for Facial Plastic and Reconstructive Surgery at 425-898-1228 or log on to sammamishfacial.com.
Tomorrow, Debbie expected a trip aboard of Florida, going to Florida on a sailboat. It was going to be a breeze. She started out in this beautiful 58-foot yacht, but ended in a small rubber raft surrounded by sharks, adrift for days fighting deadly delusions and disease.
This is one of the most amazing stories we've ever heard. The 3 thoughts tomorrow that Debbie clung to that made her so certain that she was going to come out alive, even as she watched most of her shipmates die. Thoughts that she says all of us can use to find the strength to survive just about anything.
Tomorrow, our predictions on the big winners at the Daytime Emmys. This Friday, how will your favorites fare? Find out. Plus, on days, can Hope finally remember who Isaac's daddy is? Did you get that chip out of her brain? Your brain burp over with?
And your predictions on how many of those Emmy nominees will be getting Botox before the awards ceremony?
Absolutely. Lots of peace, love, and joy.
See ya.